Treatment of premature ejaculation. Despite the fact that premature ejaculation exists as a clinical diagnosis, it cannot be classified as a disease or an illness. Irrespective of whether the cause is psychological or biological, treatment for premature ejaculation include behavioral therapy, psychological counseling, and medications. There could also be a combination of any of these methods. Behavioral therapy helps about 60 to 90% of men with premature ejaculation. In general, practice and relaxation will help in dealing with the problem. However, it should be noted that premature ejaculation often returns and additional behavioral therapy may be needed. Below are some examples of behavioral therapy methods that can be used for the treatment of premature ejaculation. The squeeze method. This method was developed by Master and Johnson some decades ago. If a man senses that he is about to ejaculate, he simply withdraws from his partner, then him or his partner squeezes the shaft of penis between a thumb and two fingers. The squeeze should be light and for about 20 seconds, then let go and resume sexual activity. The technique is repeated as often as necessary. During intercourse, with practice, a man can gain good control over ejaculation without the squeeze. The stop and start method. This second method, which was developed by Dr. Ellen Carpan, helps men with premature ejaculation to recognize when they are about to climax and they to slow down or reduce stimulation in order to extend the time until ejaculation. By starting and stopping sexual stimulation, you can learn to prolong the sex act, abstaining from intercourse. Couples may be instructed to avoid sexual relations for a period of time to help reduce anxiety. This is beneficial as while avoiding intercourse, they can spend time to focus on other types of sexual plays that eliminate pressure from the sexual encounters. This can help the man to connect and re-establish a satisfying physical bond with his partner. More foreplay. By engaging in some foreplay, couples can help each other achieve a state of high arousal by stimulating each other through kissing, cuddling, hugging, petting, stimulating the breast, genitals, and other erogenous zones before copulating. This way, ejaculation and orgasm can be achieved almost at the same time by the couples. Masturbation. In some cases, behavioral therapy may involve simple steps such as masturbating an hour or two before intercourse to help in the delay of ejaculation or stimulation of the partner to a state of arousal before copulating. Also, since an ejaculation has already occurred, the man will now take a longer time to ejaculate when having sex with his partner. Routine Kegel exercise. Researchers have noted that some men who suffer from premature ejaculation have a faster neurological response in the pelvic muscles. Men with premature ejaculation caused by neurological factors can undertake certain exercises like Kegel to help them gain involuntary control over the PC muscle and thus giving men stronger erection and can therefore help to alleviate erectile dysfunction. Counseling or psychotherapy. This can be help patients and their partners resolve conflicts and personal issues that might include anxiety, stress, and resentment that can be contributing to premature ejaculation. In most cases, this is more effective with couples attend sessions together. Current approach to psychotherapy enables men, amongst other things, to learn techniques to control or delay ejaculation, increase the confidence in sexual performance, reduce performance anxiety, modify rigid sexual partners, overcome intimacy issues, resolve feelings and thoughts that interface with sexual functions, and to increase communication between him and his partner. Antidepressant drug. That 1990 ushered in a new era in the treatment of premature ejaculation when physicians discovered certain antidepressant drugs that had a side effect of delaying ejaculation. The type of medication can be helpful as they have a common side effect for prolonging the time it takes to achieve orgasm. Medications. There are two classes of medication that can be used in the treatment of premature ejaculation, and these include the use of certain antidepressant and topical anesthetics creams. Now, however, antidepressant drugs not approved by the Food and Drug Administration FDA to treat premature ejaculation. Nonetheless, studies have shown that they are safe and effective. Topical anesthetics desensitization. Topical anesthetics desensitization creams. Local anesthetics cream may be applied to the penis to decrease stimulation. The decreased feeling is the penis may help in prolonging the time before ejaculation. Topical creams are applied to the glans penis 10 to 30 minutes before intercourse, and a condom was often used to enhance absorption. The condom can either be removed before intercourse or used during intercourse. Either method prevents possible genital numbness in the partner. Topical anesthetics include the combination product Indocaine, Prelocaine, and an herbal Korean product SS cream. To determine whether one is suffering from premature ejaculation, it is important to ask whether you or your partner's expectation about stamina or realistic, considering the fact that the average time from insertion to ejaculation is less than 3 minutes. Also, it will be helpful to note that female orgasm doesn't occur automatically as a result of prolonged intercourse. Equally of note is the fact that majority of women find it easier achieving orgasm through manual oral stimulation than through intercourse. If you are serious about knowing more about premature ejaculation and get rid of it, make sure you check out this site right here. This site is helping thousands of people get solution to overcome their problems. You can check it out instantly by clicking the link in my video below.